So I'd like to introduce myself. My name's Toby Hallowitz. I'm a naturopathic doctor and acupuncturist. And we have a clinic inside the market and the Pilgrim's market. A lot of people will shop there and don't realize that there's an actual market inside, or a clinic inside of the market. We have 5 treatment rooms. We have a chiropractor, a massage therapist, we have a counselor, and somebody does rolfing. And we're going to be having an Ayurvedic practitioner join us. Turn that down. There we go. Okay. So today's talk is about laboratory testing and weight loss. So there's a lot of information that I like to share specific to weight loss and supplements, nutrition, diet, those types of things. And I'll touch on that, but my focus today is really on an individualized, customized approach to figuring out why you or anybody else why we may be having difficulties with weight loss. I always like to explain what it is that I do as a naturopathic doctor. So in 15 states, naturopathic medicine is licensed, and we're licensed as primary care providers. That means we do physical exams, lab work, imaging, prescribed pharmaceuticals, but our focus is on natural therapies like botanical medicine, homeopathy, hydrotherapy, nutrition, diet, those types of things. And I am also licensed in acupuncture and Chinese medicine's a big part of my practice. So I wrote my thesis on nature cure in the West and in the East with Chinese medicine. And this is actually a photo taken from Austria, where my wife is from, up in the mountains, like where The Sound of Music is filmed. That's where she's from. And I had a really amazing healing experience there. But David Abram is an author I like to quote a lot. And it's the most learned and powerful healer will be one who has first learned his or her skills directly from the land itself. So what is nature cure? And it's the desire to increase one's health by utilizing the resources of nature. And nature cure was a prominent system for treating disease with natural agents such as water, air, diet, herbs, and sunshine, which developed in the 19th century Europe. So one thing I want to point out to you during my lecture, if you have questions that come up, what we'll do is just wait till the end of the section. My plan is to introduce a little bit to you some of the concepts of laboratory testing, how that relates to metabolic disease, related to obesity, because all that ties together. So I'm going to outlay a little bit of a story for you, and also, like I said, highlight important treatment approaches based on nature cure and naturopathic medicine. My presentation, this is not a presentation I've given before. I'm a clinician, so I don't do a lot of lecturing. And this is a lecture that I think is going to be really important, and I'd like to do more often. So will modify this lecture with time. But as I haven't gone through this many times, I am going to do some reading from the lectures. I'm going to try to keep it I'll try to make it basic for you, but there is a lot of scientific terms and technical information that may be difficult to understand. And so if you want to, at the end of each sort of section, or we'll make time to talk about it at that time. So basically about nature cure, it's using man-made techniques to combat that which ails us. Nature cure practitioners turn to nature for their therapies. Another picture when I had that healing experience up in the mountains. So I should just share a little bit with you. So I have Crohn's disease. And Crohn's disease is an autoimmune condition where the body attacks the intestines, causes lots of inflammation, diarrhea, bloating, a lot of gas, pain, vomiting. I mean, I was really in miserable shape, and the medications that I was given wasn't helpful. And I had the pretty typical diet. And I always like to ask this question, see who knows. So anybody know what the most common diet is in the United States?
Seafood.
What's that?
Seafood diet.
Seafood?
Sad.
Seafood, eat it?
Food and eat it.
Yeah?
Sad diet.
Yeah, so the SAD diet. Anybody know what the SAD diet stands for? That's the standard American diet. So my diet consisted of, growing up, I mean, my father was a medical doctor. He probably should have known better. But I grew up eating, I used to brag about this. My favorite breakfast was leftover Chinese food, pizza, pudding, and a ho-ho. And I probably drank 2 liters of soda throughout the day. And I was pretty active, so I wasn't really overweight. But that was certainly a big contributor to me getting sick. Well, anyways, I was really sick, and the medication wasn't helping. And my wife, being from the mountains, her father was helping out up on an alm, which is the place you bring the cows up to graze, because they don't have enough grazing land for the individual farmers. And he got in way over his head, so we came up to help for a couple weeks. And for the first time, the only thing I drank was mountain water. I ate real simple foods, homemade bread that was called dinkel, which is sprout bread, not sprout bread, spelt bread, and a lot of vegetables, a lot of dairy. But it was real simple, and for the first time, I didn't vomit, I didn't have diarrhea, I didn't have pain. I slept a lot, I had a lot of sun, I was up in the mountain air. It was a really amazing experience, and the nature really came alive and talked to me. And in fact, I took those pictures when I was up there. But I got back, and I wanted to figure out, I always knew I wanted to be a doctor, but I realized when I was in pre-med that I didn't want to be a medical doctor. And so I did graphic design for a couple years. Anyways, I came back home, and that's, I Googled, actually, they probably didn't have Google then, so whatever the search engine was, and it was natural medicine in college, and I found out about naturopathic medicine in the National College of Naturopathic Medicine in Portland, Oregon, where I did my studies. So everything fell into place, but I really had, because of my experience up in the mountains, that really drove me to try to understand nature and nature cure, which is the way, practitioners and medical doctors and healers of all sorts practice, for hundreds, if not thousands of years. So anyways, nature cure is the foundation of naturopathic medicine. We talked a little bit about naturopathic medicine and what it is, so skip that slide. But naturopathic medicine concentrates on whole patient wellness and is tailored to the patient, emphasizing prevention and self-care. NDs look to identify the underlying cause of a patient's condition rather than focus solely on symptomatic treatment. We believe in the vis medicatrix naturae, the healing power of nature. And it's a real profound statement that the body has an inherent ability to establish, maintain, and restore health. The healing process is ordered, intelligent. Nature heals through the response of the life force, the vis medicatrix naturae. I just saw Star Wars, and I have a 3.5-year-old, so it really, it's the force, right? The force of life. And we can call it many different things, but there's a common, it's intuitive. We know that the body can heal and that it has a normal healing process. So the naturopathic doctor's role is to facilitate and augment this process, to identify and remove obstacles to health and recovery, and to support the creation of a healthy internal and external environment. We try to identify and to treat the cause. Illness does not occur without cause. Underlying causes of disease must be discovered and removed or treated before a person can recover completely from illness. Symptoms are expressions of the body's attempt to heal, but are not the cause of disease. Therefore, naturopathic medicine addresses itself primarily to the underlying causes of disease, rather than to the symptoms. And causes may occur on many levels: physical, mental, emotional, spiritual. And the naturopathic doctor must evaluate fundamental underlying causes on all levels, directing treatment at root causes as well as seeking relief of symptoms. Well, what is obesity and what is metabolic syndrome? Well, obesity is a complex multifactorial condition characterized by an excess of body fat that can present in isolation, so of itself, with no symptoms, or an association with considerable comorbidities, so other problems like cancer, heart disease, diabetes, high blood pressure, gout, obstructive sleep apnea, arthritis, the list can go on. Well, what's a good way to measure if you're obese or not? And generally, there's a number of ways to do it, but we all know about the BMI, or body mass index, and that's your mass divided by the height squared. And obesity is defined in practice as a BMI of 30 kilograms per meter squared. So there's calculators, so you can always go online and figure it out, or there's charts. And it really is surprising. I mean, for me, I've always been, even like when I didn't have my belly, I always was on the heavier side, and that may have been bone structure, other things. But I am right now on the border between overweight and obese because of my height and because of my weight. Now, just being obese in and of itself, or having that label, this is just guidelines. There are, as we're going to point out, there's many more important factors and ways to measure your overall health, because that's really what we're talking about here. What is metabolic syndrome? It's the combination of dyslipidemia, so problems with cholesterol, triglycerides, hypertension, high blood pressure, impaired glucose tolerance, so like diabetes or prediabetes, obesity, and we talk about insulin resistance, which is generally considered to be the common link behind all these different factors. So all these things play together. And if you go to see your general doctor's appointment, you're going to look at these things and you're going to have measurements for it. So these are all important, but there's more that we can look at, try to understand what's out of balance with the body. Metabolic syndrome is, as you probably know, is on the rise. Obesity is on the rise. 1/4 of all Americans have metabolic syndrome. 1/4, that's a lot. And also, it's there's a variable range of expression of that. So somebody can be much further down the line in terms of having a lot of these difficulties with high blood pressure and cholesterol and heart disease and diabetes, versus somebody just starting to be obese and manifesting some of these symptoms. But why do we care about this? Why do we care about being labeled that, or having a diagnosis, or even monitoring all these different aspects of what's going on in the body? It's because we do care about how we look. We also care about how we feel. But we know that these are all individual risk factors for cardiovascular disease, particularly coronary heart disease. So getting a heart attacks. That's a big deal. And if we care about how we feel, we also probably care about living and other factors related to that. So they're linked together as an underlying problem of how our personal metabolism is out of balance. So that's what we're going to spend a lot of time looking at, metabolism tonight. What are the obstacles to weight loss? So I get this a lot, and I think part of it, I'm much more aware of it now, because in addition to having a clinic inside of the market, I also work a few hours a week in the supplement section to be there to answer questions and to be helpful for customers who come into the supplement section at Pilgrims. And whenever Dr. Oz talks about something, we get a mad rush of people to ask questions about those products and how they're helpful for weight loss. And I certainly became aware of how important it is and how we're all looking to lose weight, being on the floor, they're helping out people. But also with patients, I have many patients who come to see me. I don't want to say many patients. I've had patients who came to see me who said, look, I'm exercising, I'm eating well, I don't understand it. Why am I not losing the weight? It just doesn't make sense. And so, we spend time in going over and looking at diet and lifestyle, exercise, and maybe supplements and things that they're doing. And a number of times it did come up that we really got to try to figure out what is going on here. And I think my desire to put this lecture together was just seeing that there's such a place for this to really get an understanding of what is going on with over 1/4 of our population. And there's a much greater picture to solving and working with health problems, so that what is out of balance here, and how can we restore that balance? So that's why I'm excited about sharing some of these things with you tonight, putting that picture together. I debated whether putting this slide up or not, but we'll just move on. Restore balance, remove obstacles to cure. Restore balance and remove obstacles to cure. The body has an innate ability to heal itself. We need to find out why it's not being able to do that. I recommend probably to every patient that I see, and probably to every customer that talks to me on the floor, this book. It's called Deep Nutrition. It's by Dr. Kate Shanahan. I discovered it probably 6 to 9 months ago, and I was thrilled to find out about it because it's basically my philosophy on diet and lifestyle, but she does a great job of explaining why certain aspects of nutrition are important, and I was thrilled that I could share that and have patients read it. So I highly recommend this book. I do believe that there's not one diet that is specific for each person, but in general, I like the way that this is presented. It's very readable. What she's basically doing is looking at indigenous cultures and also cuisine from cultures where there's such a history, like in Italy or Greece or Africa, or where people have accumulated knowledge of what is the most important things to eat for reproduction, for having healthy babies, for being healthy. What do these people know as their valued treasures? And it's really is a great presentation. So we'll talk a little bit about diet, and this is a couple quotes from her. Let me make this plain. After somebody asked about eating saturated fats or animal fats and how that's healthy for you. Natural fats, including not just coconut and avocado, but also animal fats from animals raised in a caring and natural environment, are a vital and important part of any optimal diet. I say optimal rather than good because you can do very well on a whole food diet that does not include these fats, but she did say a whole food diet. She didn't say that in that quote, but it's really important to eat dairy and animal products that are grass-fed. I will spend some more time talking about some of these concepts that aren't related to testing in some lectures coming up here and at the Pilgrim's Market the first, actually next week in February. So fat burn is an acquired talent. Well, sort of acquired. Actually, we're reminding our metabolism of an innate talent that it's had for thousands of years before we came along and started eating low fat. Kind of like relearning a language you used to be fluent in during early childhood. Many people who have been following low-fat diets for extended periods, months, years, have lost much of their innate capacity for burning fat and need to jumpstart their fat-burning enzymes by including plenty of healthy fat and cutting back on other fuels, particularly sugars. So really what she stresses is a low-sugar diet, low-carbohydrate, simple carbohydrate diet, and avoiding vegetable oil, vegetable fats. And that sounds kind of contrary to what a lot of us have heard, particularly the last 20, 30 years. But let's just take a basic general look at diet and what's out of balance. So whole foods, no junk food, no soda, decreased sugars and simple carbohydrates. I think my opinion is it's okay to have to stick with like sprouted grains and complex carbohydrates in limited quantities. No vegetable oils, no hydrogenated oils. Fresh fruit, but minimal. We can't go overboard with fruit. Fruit, as we'll learn, is very high in fructose and sugars, and that can still add to the problem. But we need to eat a lot more vegetables. I think that a lot of the research that shows vegetarian diets are so beneficial for you, in terms of cardiovascular disease and other components, is because a lot of vegetarians eat more vegetables. Some don't, but it's important to eat a lot more vegetables. Grass-fed meats, dairy and eggs, bone broth, organ meat, cultured food, and then omega-3s, fish oils. And I won't go into it much here, but a lot of people want to get their fish oil or get their omega-3s from flax oil. I I don't think there's much benefit in doing that. There's a good chance that like different numbers are out there, but there's a large proportion of us, maybe as high as 70, if not more, that have a difficult time converting the flax oil into EPA and DHA, the type of oil that's in fish oil that the omega-3s that we're looking for. And I won't talk about this here, except I love vitamin K2. Vitamin K2, well, I may talk about it later if we have time, but it's really important. The only way we get vitamin K2 in our diet is from eating grass-fed meats, dairy, and eggs. And the chickens it can't just be free range. They have to be eating grass. Not exclusively grass, but they have to be eating grass as part of their diet. And you'll notice in the yolks of the eggs that they're bright red, or more red, dark orange. Exercise, you know, I'm sure they go into good detail here at the Kroc Center if you're working with any trainers, but I do like interval training a lot. Strength training, you know, building up your muscles is a good way to burn the fat, and it is important to exercise. No matter what else you do, it is really important to move. And there's a lot of different, you know, one of the people that I talk a lot with, Ben Greenfield, he's going to be here next week. That's his area of expertise, and he can answer some questions about exercise. But it is really important to move. And also to find out, you know, work with your body and what you're capable of doing, because if you have, you know, knee pain or hip pain or other limitations, you know, we have to work with you. You don't need to push through something, but we can always find some way to increase your exercise. Nature cures sleep, stress. You're not going to lose weight if you're not sleeping. Some of the labs that we're going to talk about looking at will help identify problems that can relate to sleeping, but you have to sleep. If you're not sleeping, you're not losing weight. If you're stressed, that's going to promote problems with your adrenal glands and cortisol, and that's going to hinder any ability, or it's going to slow the process of losing weight down and you know, likely add to the weight gain. So I like to use the terms microcosm, macrocosm, but it's basically looking what's out of balance with everything that's outside of us, in our relationships, in our work. A lot of it is related to, you know, living a Western culture, but we have to be aware of it. We can't just say that's not part of who we are and what we're experiencing. So, you know, if you can't notice what's out of balance, you know, talking to a counselor, talking to a loved one, talking to a friend, take the advice, try to figure out, because sometimes we don't see it. And somebody else can bring that up to you. And so, you know, when I sit down with patients, I spend an hour and I go over a lot of these different aspects, and I can see what's out of balance in that external environment. But what we're going to be looking at next is what's out of balance internally. What's out of balance with our body's chemistry. And I like to extend that, though, in what's going on out of balance with the world. So extending it to the environment. I don't know if you've heard of the Gaia hypothesis, but that the world is sort of like a living organism and everything interrelates. And I do believe in that. So looking to restore balance on all these levels. So we're going to look at some of these topics now. Hormones, metabolism, inflammation, immune system, dysbiosis, some specific vitamins, minerals, orthomolecules, which are not necessarily vitamins, but are molecules that our bodies have incorporated that work like vitamins, that are requirements of the body that, you know, we only get through ingesting, like vitamin C and antioxidants, you know, so that's those types of things. And then we will talk a little bit about genetics and epigenetics. So looking at like some sex hormones, what happens during menopause, that, you know, there's a decrease in estrogen which can lead to central obesity, and that we know that this is linked with insulin sensitivity. We know as you're, you know, perimenopause, as you go through menopause, that it's really common to lose weight, and it's really hard to get the weight off. You know, like if you were used to being active and doing that same routine, it comes off. Now it doesn't come off as easily. And there's important testing. You know, you can do your standard blood test for estrogen, progesterone, testosterone. I like to include cortisol testing and DHEA testing, which is monitoring your adrenal gland function. And it's, doing you're taking a saliva sample in the morning again before lunch, before dinner, and before bed. And it's looking at a sort of a daily cycle of DHEA, which is a precursor hormone to adrenal, and it's also and looking at the cortisol. And depending on the pattern that we see, sometimes it could, like the morning, afternoon, it could be too high, and could be too low in the evening. But the patterns that we see tells a lot about how your body's coping with stress. And so we do get a lot of information from that. There are a lot of studies that look at hormone replacement therapy and how by taking hormones, estrogen, progesterone, how that can stop the fat accumulation in the central obesity in this region. So there's definitely something to that. There are a number of studies out there, but you can see that study was done in 1998. We have more concerns now about using hormones. I do feel like there is a place for bioidentical hormones, but on an individual basis. And I like to use other options first: herbs, acupuncture. There's a product I like to use called Estravera, which is a special extract from rhubarb. It's a selective estrogen receptor modulator. I've seen it help the majority of women with hot flashes, but it helps balance the hormones, and it can help a lot with even weight gain, sleep, a lot of these other problems besides just hot flashes and night sweats. But there is a whole host of different strategies to help balance the hormones, but you want to know what is out of balance with your hormones. We know that there's a low cortisol. We know that if there's a low cortisol response and low DHEA levels, that this is also linked with weight gain and obesity. A little bit more about adrenal hormones that decrease cardiovascular and/or cortisol stress reactivity. Were associated with obesity and the risk of becoming obese, symptoms of depression, anxiety, poor self-reported health, poor lung function, poor cognitive function, etc. So what that means is, if you have a stress, you're supposed to be able to respond to that stress. Your cortisol goes up, but then, your cortisol level is supposed to go down again. Well, so if you're exposed to stress constantly, your cortisol goes up. Eventually, it doesn't really, come down, and then your adrenals then get exhausted. So we call that adrenal exhaustion or adrenal fatigue, and then you stop producing cortisol. And so that's why doing that cortisol test can tell you where you are, particularly with the DHEA, to see where you are and how you need to be treated. And sometimes there's treatments that I do that's natural that can help if you have problems sleeping and your cortisol levels are really high at night. There's things that a lot of times you have insomnia, you don't sleep, so we can do things to change that to help with the cortisol levels at night, and they could be deficient in the morning. So there's a lot of variables and ways that we can work from that testing. And I have a couple test kits. I like to use the ZRT labs for that. There's age-related decreases in DHEA, which is in association with increases in obesity, insulin resistance, and atherosclerosis. So as we get older, we make less DHEA. DHEA has been sort of thought of for the last 10 to 20 years as a, what do they call it, the fountain of youth hormone. There is some really good info out there about DHEA being helpful, but you have to know where you are in that cycle. Not everybody needs DHEA, and you do need to be careful with it. There are some studies that showed failed benefit of using DHEA as a supplement, and as far as for decreasing weight and insulin sensitivity on its own, but it's still imperative to restore normal adrenal function for proper stress response, energy metabolism, sleep, and hormone balancing. Okay, we know one of the first things everybody thinks of when you're not losing weight is your thyroid. So we need to look at the thyroid. One of the major symptoms of having a hypothyroid is weight gain. So it's important to look at your thyroid test. Now, a lot of times you'll just get a standard screening test will be a TSH. I like to look at free T3 and free T4 as well. And I think it's really important, especially if you have thyroid, if you're showing problems with your thyroid, either too high or too low, is to run an antibody test to see if you're producing antibody response to your thyroid, because Hashimoto's thyroiditis is probably the leading cause of hypothyroid. And it's really important to know. A lot of times we may just assume that is, but I like to know, because sometimes you may think it is. Like I've had patients, I say, oh, for sure, I'm positive that their thyroid's under attack. And they weren't, that didn't seem to be the case. If we know that there's an autoimmune condition going on, that can change how we look at treating your body, doing natural approaches to helping with this autoimmune condition, or your body attacking itself. We can also look at reverse T3. I'll get into that a little bit, but that's when sort of like a subclinical hypothyroid, where your numbers look good, your T3, T4 all look about good, but you're still having symptoms. Everything else seems like you're hypothyroid, and that's because your thyroid hormones, the T3, the active hormone, does not seem to be functioning the right way. If your cells cannot convert T4 to the 4 times more active T3, a person can have normal levels of thyroid hormone in the blood, yet be thyroid deficient. It's called Wilson syndrome, and it's also called subclinical hypothyroidism. And it's thought to be associated with deficient peripheral conversion of T4 to T3. Well, there's particular minerals and herbs that can be really helpful to assist the body to do that conversion. You may have heard of people doing basal body temperature, which is taking your temperature first thing in the morning. That's another way that sometimes can signify if you're low in, if you're having this subclinical hypothyroid. Those are some of the levels. You can have a low level of circulating T3s, but slightly elevated circulating levels of T4, and your TSH could be a little bit suppressed. So the TSH is what tells your thyroid to make more thyroid hormone. The T3 is the active hormone. That's the one that's doing the work. So the T4 has to turn to T3. If it's not doing that in your tissue, you're going to notice problems with that. I like to use the salivary and the blood spot thyroid hormone testing. It's claimed to be a little bit more sensitive for measuring peripheral hormone levels. It's because it's whole blood. It's from the finger prick is you just do like a lancet to the tip of your finger. You put the blood onto a card, and you send that card in. Well, we're looking at blood from the capillary, which is more like what's the blood that's in your tissue, as opposed to a venous blood sample. Because the venous blood sample is partially spent of life-giving components and is returning to the heart, lungs, and gastrointestinal tract to pick up another load. So it's not quite the same blood that's at your in the tissue. It may be a more accurate assessment of hormone levels that affect your body's tissues. Okay, any questions about thyroid and those hormones before we moved on to vitamin D, another hormone? So I said vitamin D, another hormone, because vitamin D has, it's a vitamin, but it really has action like hormone. It's a precursor to your hormones, to cholesterol and these other steroid molecule synthesis, but it really does act like a hormone. And I'm pretty sure everybody here has heard of the benefits of vitamin D. The research is just exploding on that, and it has been. Vitamin D levels are low in obese adults and linked to components of body composition, particularly body fat mass. Alterations in the vitamin D endocrine system have been reported in obesity. So there's problems with vitamin D formation when you're obese, and those problems continue with weight gain and a lot of other problems with metabolic syndrome. Let's see, this is one trial done in 2012. They concluded among healthy, overweight, and obese women, increasing vitamin D concentrations by vitamin D3 supplementation led to body fat mass reduction. So in other words, getting your vitamin D levels up helped to reduce weight, and particularly fat. And that was done in 2012. Okay, one thing I want to point out is with vitamin D, it's my belief, and there's more research showing this, and a lot of alternative-minded practitioners, they want to stress that it's important to get D3 and not D2. D3 is a natural form of vitamin D. A lot of times, like if you go to the medical doctor, they'll see that your vitamin D levels are low, and they'll put you on maybe like 50,000 IUs once or twice a week. But that's vitamin D2, and the D3 that's in our body, or the D that's in our bodies that we use is D3. D2 is not normal or natural to our bodies. And so there's some evidence that it's usually considered by mainstream that D2 and D3 is the same. There's some evidence that shows it's not. I would much rather see people get their D3 levels up. I also want to say this, we're talking about cardiovascular disease, metabolic syndrome, these types of things. I mentioned vitamin K2. The reason why vitamin K2 is so important is that as people are taking more calcium and vitamin D, we're actually seeing a rise, some studies are showing a rise in heart attacks. That's because the calcium is precipitating in the coronary arteries, in the peripheral joints, or in your joints and other tissues of our body, kidney stones, those types of things. And the belief is that it's because we're deficient in vitamin K2, because it's not in our diet. The only way we really get it is through grass-fed dairy, meats, and eggs. And the majority of the dairy, meat, and eggs that we eat in this country is from feedlots, and they're not getting the grass. So we're very deficient in this vitamin. And there are studies that show that K2 will help prevent coronary artery disease and heart attacks, among many other things. The research is now exploding on vitamin K2. I didn't show it here, but there's a vitamin, if you're interested in vitamin K2, there's a great book that we now carry at Pilgrim's Market. I think it's called Vitamin K2 and the Calcium Paradox. Let's talk about inflammation. The obesity epidemic has forced us to evaluate the role of inflammation in health complications of obesity. This has led to a convergence of the fields of immunology and nutrient physiology, and the understanding that they are inextricably linked. So immunology, inflammation, nutrients, all these are linked to obesity, to weight difficulties in losing weight, and cardiovascular disease. So the reframing of obesity as an inflammatory condition has had a wide impact on our conceptualization of obesity-associated diseases. And I think we're starting to see this in mainstream media. I'm curious, raise your hands if you've heard of thinking about fat and obesity as being an inflammatory condition. Okay, so it's out there, and now you know about it, and we'll share a little bit some more of that concept. So let's see, this was a study done in 2011, inflammatory links between obesity and metabolic disease. Inflammation is the body's response to harmful action, with the goal of returning the body back to a normal baseline. That sounds a lot like the vis medicatrix in Nature Cure, doesn't it? Inflammation is the body's response to harmful action, with the goal of returning the body back to normal baseline. So inflammation is a normal response. The inflammatory response triggered by obesity involves many components of the classical inflammatory response to pathogens, and includes systemic increases in circulating inflammatory cytokines like TNF-alpha, C-reactive protein, which a lot of you probably have heard of, but we're talking about inflammatory cytokines, what your white blood cells and other tissue in your body releases to bring on inflammation. And it does that because it helps the immune system. So it's all part of the immune system response. So those cytokines recruit white blood cells to the inflamed tissue, and it also activates the white blood cells. And the goal is to generate a reparative tissue response. The nature of obesity-induced meta-inflammation, which means inflammation everywhere, is unique compared with other inflammatory paradigms, like infection or autoimmune disease, in a couple key ways. The chronic nature of obesity produces a tonic low-grade activation of the innate immune system that affects steady-state measures of metabolic homeostasis over time. So, low-grade inflammation that is actually, slowly progressive, but it changes our body's metabolism, all the biochemistry that goes on inside of your cells. So obesity begets inflammation. inflammation begets further obesity. So the fat it causes inflammation. Inflammation causes further fat increase, and it's this vicious cycle. I really like this chart. Can you see that? Yeah. Oh, I got to hold it down. Okay. You can see here that as the weight goes up, so does these pro-inflammatory signals. But the homeostatic, which means keeping balance, the immune signals, the balance decreases. So in the brain, we see the brain responds to signals like leptin and insulin, all designed to make sure the brain gets sugar so that it can function. The brain functions on sugar. Well, this gets out of balance. We start seeing insulin resistance. The adipose tissue expands in size, but it also affects the immune cells. The liver increases. We get steatosis or fatty liver here with immune cells, and then you get fatty liver. You start getting the inflammation, which the body then tries to repair, and we get fibrosis and cirrhosis and other problems of the liver. Even though we never drank alcohol, or the alcohol is not an issue, or hepatitis C, or the viruses aren't an issue, even the muscles, they start accumulating fat and get insulin resistant, and we started having issues with muscles. The blood vessels, look what happens. We get atherosclerosis, hardening, of the arteries, the coronary arteries. And the pancreatic cells that secrete insulin, they end up dying. And you can see it's this increased free fatty acids, decreased adiponectin, increased cytokines, endotoxemia, which is toxemia from the bacteria inside of your gut. These are all factors that can lead to this. But we're going to be spending some time talking about leptin and insulin coming up. So it is clear that inflammation participates in the link between obesity and disease. We have these inflammatory markers, the C-reactive protein, SED rate. We talked about some of those cytokines like TNF-alpha, IL-6, IL-10. There are ways for us to measure these things, and I'm going to talk about that towards the end of the lecture. The macrophage at the intersection of immunity and metabolism and obesity, this was in 2011, but we know that white blood cells are involved. This is an excerpt from that article. Adipose tissue expansion in obesity results in inflammatory state characterized productions of adipokines, which is adipocytes is fat cells that are secreting these inflammatory mediators. Cytokines are different white blood cells that secrete those mediators, and chemokines are other attractants. But it's through this inflammatory pathway that propagates the inflammatory response and results in muscle inflammation and insulin resistance. So if you look at the molecular pathways involved in obesity and inflammation, we're looking at different signaling pathways that participate in translating obesity-derived nutrient and inflammatory signals into a cellular response relevant to disease. These include pro-inflammatory and anti-inflammatory signals, and they affect our genes and the way our genes get expressed. And so that's what this is sort of a graph of. And we can look at the blue. This is a cell membrane. These are receptors on the cell. So when fish oil attaches to these receptors, it stimulates these genes to express themselves, NF-kappa beta. It's really strongly anti-inflammatory. Same thing with a hormone called adiponectin, which is really important for weight loss. And that you get that hormone, it binds to the cell, and again, it's beneficial. However, you get different things can bind to different receptors, these cytokine receptors, and they turn on genes that express inflammatory proteins and create more inflammation. So we are talking on a genetic level. Anybody heard of this book, The Fat Switch? Okay, another book that I really like. We don't carry this yet at Pilgrim's, but you can get it at Amazon. That's where this picture is taken from. So it's looking at uric acid. And uric acid is an important component used by animals to prepare for hibernation, to rapidly increase fat accumulation. So he's looking at all these animal studies of what these animals who are hibernating, and they've got to put on weight. And he's looking at these chemical signals inside the body that are responsible for that. And uric acid seems to be central to that. And so uric acid is involved on the switch to be turned on for hibernation, to become fat, or to lose the fat. Mitochondria produce the energy which runs the cell. Uric acid causes oxidative stress in the mitochondria, injuring specific enzymes involved in energy production. So the mitochondria are inside your cells. Their role is in the biochemistry to produce energy. And uric acid will cause oxidative stress. You know, like when you hear about free radicals causing problems, that's what free radicals do. Uric acid causes problems inside the mitochondria, so less energy is being produced. And this can lead to citrate accumulation. This is one of the mechanisms that uric acid increases the fat creation in your body. So citrate stimulates fat production. Uric acid also inhibits enzymes required for burning fatty acids, leading to less ATP or energy production. So the net effect is stimulation of fat synthesis, less fat burning, and reduction in energy output. Food gets turned into fat, not into energy. We're fatigued, and we're getting fatter. This is an illustration of that. The uric acid increasing oxidative stress. Fat production increases, fat burning decreases, increase in fat, decreased ATP energy production, you get tired. So looking at uric acid as a model for survival factor under stressful conditions, you see a raise in blood pressure. It causes insulin resistance. This is increasing uric acid, increases fat stores, stimulates inflammation. It stimulates foraging for hibernation. So it has a lot of functions. He actually accounts a lot of different details that uric acid also does for really unique animal behaviors as well, particularly reproduction. So we need to look at uric acid as having other signals, not just creating painful gout. Uric acid should be viewed as a mayday signal by the animal under conditions of starvation or stress. The result is an increase in fat accumulation, insulin resistance, a rise in blood pressure, the stimulation of inflammation, and activation of the immune system. These findings are similar to what animals undergo when they activate the switch to maximize fat storage and are comparable to metabolic syndrome. This is Dr. Johnson, the author of the book, The Fat Switch. So the take-home message is, for relating to the fat switch, is that what is the biggest promoter of turning on the fat switch? Well, it turns out it's sugar. And in his case, he says it's especially fructose, which we know is high in fruits. Using nutrition, supplements, and herbs, we want to get the uric acid levels down below 5.0. So that's another marker that we can look at if you're having problems with weight loss. So another thing that we can add to seeing what's out of balance. Inflammation, is there a problem with uric acid? That's a marker. And then the good thing is there's things that we can do. There's things that a medical doctor can do as far in terms of medication, but there's also a lot of things that can be done naturally as well. And by doing this, this will support mitochondrial function. Any questions about some of these concepts we just talked about? Okay. Is it getting warm in here for everybody or just me? Can we turn down the heat a little bit?
Has that study only been done on animals?
They're doing some studies on people, but he's kind of working behind that, and there are some studies relating to uric acid. But the majority of, a lot of the work in his book is on animal studies. But there is studies looking at uric acid in humans as well, being involved in this process.
I was wondering about, like you said, going to the doctor or being with him on something, what would you suggest? Like a regular GP or what?
I'm not sure I understand your question.
You know, we're talking about the metabolic, what's it called?
Well, I think people should work together with their doctors, yes. And so, you know, if you're not able to work together with your doctor, then you should find somebody who will work together with you.
Willing.
Good. So if he's not familiar with some of these concepts, then you can introduce that to him.
Okay. All right.
And see if he'll work with you. I think one of the reasons, you know, we all know that there's a rise in alternative medicine and integrative medicine. And I believe the reason for that is basically, you know, self-empowerment, because it's not, you shouldn't just go to a doctor and most people feel this now, just do whatever the doctor tells you. You're responsible for your body. You're responsible for the health of your body. And so you need to take charge of it. Now there's so many different ways that you can go about doing that in whatever paradigm that you're in. But you know, it's too easy nowadays to just get lost in the system. So take responsibility for your body, and that's why you guys are here. But you should be able to communicate with your professional team. And it's important to work, I think it's important to work with professionals and health professionals. It doesn't always have to be necessarily a medical doctor, but it should be somebody trained and qualified to assist you. So the ratio of omega-6 to omega-3 polyunsaturated fatty acids, omega-6, omega-3 fatty acids, in the Western diet ranges from 10 to 1, 20 to 1. I've seen reports 50 to 1. And that's because of the SAD diet. Some countries like Japan, the ratio is more closer to 1 to 1, like 4 to 1. But that should be our goal, is to get the ratio closer to 1 to 1. There's testing that can be done looking at red blood cells, and it measures the EPA and DHA and can show different ratios, or can illustrate that ratio between omega-3 and omega-6. And that is a good cardiovascular disease risk factor. We know that obesity and increased adiposity or fat are associated with a chronic low-grade inflammation of the adipose tissue. EPA and DHA also have important anti-inflammatory properties that modulate adipose tissue inflammation. So one of the first things like that I think is really important is if you have an autoimmune condition, one of the best things to be on is fish oil, high concentrate of EPA and DHA, and we know that that has a strong anti-inflammatory property. And we're seeing, you know, the research shows that. I see it clinically. It's one of the better things that you can do. It's also really important for dealing with inflammation in obesity and metabolic syndrome and to help you lose weight. EPA and DHA prevent excessive adiposity and insulin resistance. EPA and DHA increase fatty acid oxidation, so it helps you burn fat. It decreases lipogenesis, which is fatty acid production. So it decreases the amount of fat that gets produced, and it also helps with insulin sensitivity. I wish I had this. I got to find the slides for this, but I don't know if any of you went to the lecture put on by Nordic Naturals at Pilgrim's Market. But Dr. Stewart, he put some slides up that showed mice that had eaten the standard high vegetable oil diet, just this pretty standard American diet, and the obesity. They would cut open the mice, and you actually saw the omental fat. And then he put those mice. The mice were put on. This wasn't his study, but the study put the mice on fish oil, high quality fish oil, and I forget the length of time, but it's probably like 2 or 3 months. Then they look, or for mice it's probably shorter. But anyways, they opened up, and all that omental fat was gone. It was quite dramatic, so it really sticks in your mind. But like I said, we can test for this. And there are more and more tests coming out. This is a blood spot test where you do a pinprick to your finger, and you put it on a card, you send it in, and it's looking at the types of fats that are in your blood. Here we can see the alpha-lipoic acid or alpha-linoleic acid, the EPA, DHA, different, the amounts that are there, omega-6. Then it also measures arachidonic acid, which is a fatty, is inflammatory. It's necessary, but when it's on excess, it's really inflammatory. And then trans fatty acids and different ratios here that can be really important. So I think that can be really valuable information. One thing I do want to point out, I'll be with you one second. One thing I want to point out related to fish oil, too, is that you need to taste your fish oil. If you're taking capsules, you need to bite into it and you need to taste it. If it tastes fishy, it's oxidized, it's rancid. What do we talk about, like mitochondrial oxidation, right? It's causing problems to your body. It's causing more harm than good. So I always want to make sure people get good quality fish oil. And if you're taking fish oil, you need to get enough of it. And there's differing opinions as far as what that is, but my opinion is that you need to get, if you're dealing with cardiovascular disease and inflammation, you need to get probably a minimum of 1,000 milligrams of EPA and plus DHA. So you add up the levels of EPA and DHA. But please, if you're taking fish oil, taste it. If it tastes fishy, it's causing problems. Don't take it anymore. Get a good quality fish oil.
What's it supposed to taste like?
Taste like oil. Like anybody, if you eat sushi, sushi's a good sushi or scallops or shrimp, right? If you go and if you go to like some you go to some restaurant and you get bad tasting shrimp, it's really fishy, right? That means it's sat out, it's oxidized, it's aired. It's not good quality. If you eat sushi, it's fresh. There's zero fish taste to it. That's fresh. Okay, so if it tastes like fish, that means it's been oxidized. Now, some are worse than others. If you're burping it up, that's a likely indicator that it's oxidized. A lot of times we'll add like lemon flavor, so if there's lemon flavor to it, it'll taste a little lemony. But it just tastes like, I like to use liquid, where you take a teaspoon of it. In 1 teaspoon, you get like 2,500 milligrams of EPA and DHA. Just because on the front of the label of the fish oil bottle it says 1,000 milligrams of fish oil, that has little value to you. You need to look at the EPA and DHA quantities. Yes? Yeah, if you're vegan and or you're allergic, if you're allergic to fish, you mean not shrimp or seafood, but actual fish? I mean, if you're allergic to fish, you may want to avoid that. They do make DHA from algae, so there's a vegetarian source. Like I said, I'm not the biggest fan of flax oil. That's still debatable. I mean, there's still some research that shows it may be okay. I would just prefer to people to take fish oil, good quality fish oil. Yes? Vitamin K2, we're seeing some studies, and we're seeing those levels kind of rise like we did with vitamin D. I would say, you want to take 50 micrograms as a minimum. I like people to take 100 to 200. Now, it depends on your situation. If you're trying to use it therapeutically because you're really worried. Okay, dysbiosis testing. Raise your hand if you heard that bacteria in your gut can be correlated with obesity and weight gain. Oh, yeah, it's in the news a little bit. You'll hear it. So this is something that I think is really important. I tend to do a lot of work because of the Crohn's disease that I've had to specialize or see a lot of Crohn's, colitis, IBS patients. And I have long valued, and most naturopaths would, the importance of having the right bacteria in your system. So let's just talk for a couple minutes about that. Gut microbiota or bacteria refers to the trillions of microorganisms residing in the intestine and is integral to multiple physiological processes of the host. Recent research has shown that gut bacteria play a role in metabolic disorders such as obesity, diabetes, and cardiovascular disease. This is a review article. Is the gut microbiota a new factor contributing to obesity and its metabolic disorder? Well, yes, it is. Gut microbiota has evolved with humans as a mutualistic partner, but dysbiosis in a form of altered gut metagenome and collected microbial activities what does that mean? So different bacteria, like the bacteria all have different genes in there, and those genes combining with our genes and the yeast genes and all these different factors combined with our own genes and environmental factors may promote the development of metabolic disorders. Gut bacteria affects metabolism by increased energy extraction. So based on what type of bacteria you have there, if you have good bacteria, you may be extracting more energy or less fats or more, different carbohydrates, that type of thing. The bacteria affect the immune system, and they also affect our fat metabolism. And it makes sense because these bacteria have developed over time to assist us with our digestion and being able to take the food that we eat and turn it into energy that we use. So both the physical presence of bacteria and the metabolites, what is secreted by the bacteria, are responsible for these effects. There are a couple mechanisms like immune response and the way that they digest our fiber and create like a short chain, what do you call it? Anyways, changing the fiber, having different biological activities can affect how your body works. So it appears that human obesity is associated with a low abundance of intestinal Bacteroides and a high abundance of, I don't know how to pronounce that. Anyways, this one right here. Anybody know how to pronounce that? Firmicutes? I'm going to have to learn how to pronounce that one. So different bacterial species has a different effect. If you are high in the B bacteria, right, it could lead to obesity, or if you're high in, so different populations. And in fact, there's some studies out there that show that there's like 3 different groupings of bacteria, and identifying them, and based on which group you're in, that will kind of tell you whether you're going to have weight gain and obesity, or be thin, or have all these different problems. But they're really starting to study this, the importance of this. In one of the tests that I do, there's an adiposity index, and it's derived by using DNA probes that detect multiple genera of phyla. Abnormalities of these phyla may be associated with increased caloric extraction from food. So here you can see this is, so you can do a stool analysis. I like to do stool analysis with people who have digestive problems. But you can see that there's important information that can relate to metabolic disease and to weight loss. So these are measuring, so you're actually taking a stool sample and you're sending the stool sample in, and they're analyzing it, and they do a lot of different tests for it, but one of the tests is just measuring the amount of bacteria that they see there. They're looking for parasites, but there's this adiposity index. In other words, you want the F bacteria to be low, and you want the B bacteria to be high. And you can, if you see it reversed, if you're not obese, that's not a good sign. But it also can play a role into, okay, how can we change this so that we get the right bacteria into your intestines? There's another form of testing called organic acid testing, and it's something that I'm getting increasingly familiar with and using more in my practice. Organic acids are metabolic intermediates produced in pathways of central energy production, detoxification, neurotransmitter breakdown, and intestinal microbial activity. So they're metabolic products, waste products. They're excreted by your cells, and you urinate them, and we take a sample, we send it in, and we test for about 50 different metabolites. Accumulation of specific organic acids in urine often signals a metabolic inhibition or block. This abnormality may be due to a nutrient deficiency, inherent enzyme deficit, toxic buildup, or drug effect. So if you're deficient in certain nutrients, we'll see different metabolites build up. If there's, sometimes it could be related to your genes and what enzymes are produced. So we have different variations in enzymes. You could be exposed to toxins that will affect these pathways. Certain drugs will have an effect. Testing for organic acid helps reveal activity and changes at the metabolic level, helping practitioners discover hidden issues and pinpoint where therapeutic focus is needed. So this test is great when we're like, we looked at some of these other factors and we're like, well, it seems like we're doing everything right, but I'm not losing weight, or I'm not feeling better, or what's going on here and why is that? And so that could be because of some of these factors. Like we said, nutritional deficiencies, vitamin deficiencies, mineral deficiencies, things that you're exposed to. So let's try to find out what makes you unique and why that's happening. And organic acid testing can help us with that. So other things it looks at, vitamin mineral deficiencies, carnitine and N-acetylcysteine. These are amino acids. Carnitine is really important for the transfer of fatty acids across the cell membrane, so it's really important for to help you burn your fat. Oxidative damage and antioxidants, so how much antioxidants you're taking, how much poor tasting fish oil you're ingesting. That's oxidative damage. Indicators to assess detoxification, so are you detoxifying? Are you getting enough B vitamins, neurotransmitters, mitochondrial energy production, looking at the citric acid cycle, lipoic acid, CoQ10, and other dysbiosis markers. So these are things that organic acid testing can be really helpful for. Blood sugar dysregulation, weight gain. Okay, but also fatigue, sleep problems, problems with your mood, nausea, multiple chemical sensitivity, bloating, problems with detoxification, reflux, digestive problems, autoimmune conditions, skin conditions, depression, anxiety, cancer, inflammation. So we can learn a lot about you, what makes you unique, and how do we customize our approach to correcting these metabolic problems. This is a sample of some of the tests of the organic acid testing. Looking at these markers can relate if you've got deficiencies in B vitamins. So if in this one here, if your B6 is low, you'll see higher levels of this. That seems to be the case here. We didn't talk much about methylation, but methylation is really important for cardiovascular disease. B12, folic acid, this is a good way to measure that. So we get a lot of information related to B vitamins. We talked about citrate, like these are in the citric acid cycle. If, depending on what's going on here, this can relate to whether you have enough CoQ10, if you're getting enough protein in and amino acids, which are the building blocks, for so much of what goes on in your body, magnesium. But this, the citrate we were talking about, so if that's high, we know that can lead to fat production. Other things with fatty acid metabolism, we talked about, carnitine and B2, and so we can know this will usually indicate that there's issues with either breaking down the fat or increasing fat. But usually we'll use this to see if you're breaking down the fat okay. Carbohydrate metabolism, energy. We'll just go through a couple quick things. Food allergy testing, we know that can be important. We know that serotonin decreases after eating an offending food. In order to compensate for lower brain levels of serotonin caused by eating foods that you may be sensitive to, it causes you to crave foods which will increase serotonin in the brain. Ingestion or eating highly refined carbohydrates like sugar causes a rapid release of insulin, increasing blood levels of tryptophan, a precursor to serotonin. So that's why we go have these cravings for sugar. And we know that that's part of the vicious cycle as well. So it's important to find out what foods we know that foods will cause inflammation, and we know that overall inflammation, if we can do things to decrease your inflammation, that's going to be beneficial for you. But directly, we know there's that serotonin response as well. Food allergy relates to leaky gut, which relates to proteins getting through, inflammation in your GI tract, changing the bacteria in your GI tract, and leading to more insulin resistance and more fat storage. Another book that I like is The Rosedale Diet, and he's talking similarly about the hunger switch, and he focuses a lot on leptin. So if you're interested about the leptin that I was going to talk more about leptin and adiponectin, these other fat signals that are really important. But we'll just quickly go through it. So the leptin controls appetite and weight loss by telling the brain when to eat and how much to eat and when to stop eating. New research shows that leptin may be one of the body's most important hunger control mechanisms. Control leptin and you control your weight. Metabolism can be roughly defined as a chemistry that turns food into life. Fat is not just an ugly energy storage depot, it's an endocrine organ, excreting hormones like the pancreas, ovaries, and pituitary. So your fat excretes signals. Fat releases the hormones leptin and adiponectin and other adipokines. We know that it causes more insulin resistance, we know about the relation of insulin resistance to weight gain and diabetes and metabolic syndrome. But it's primarily caused by the ingestion of sugars. And leptin is a very powerful and influential hormone produced by fat cells that has totally changed the way science looks at fat, nutrition, and metabolism. It is secreted by fat and it communicates with the brain, and it tells your brain whether you're hungry or whether you need to eat and make more fat. Leptin is the hormone that regulates your set point of weight. If a person is getting too fat, the extra fat produces more leptin, which is supposed to tell the brain that there is too much fat stored. More should not be stored, and the excess should be burned. So the role of leptin is to stop being hungry, to stop eating, to stop storing fat and burning off extra fat. If you're eating a diet that is high in sugar and grains, this is the same type of diet that will also increase inflammation in your body. As the sugar gets metabolized in fat cells, fat releases surge leptin. And over time, your body is exposed to too much leptin. It will become resistant to leptin, just as your body can become resistant to insulin. So the signal is not being heard. When you become leptin resistant, your body can no longer hear the messages telling it to stop eating and to burn fat. So you remain hungry, and more fat is being stored. Leptin resistance can lead to obesity, diabetes, heart disease, osteoporosis, autoimmune disease, reproductive disorders, cancer, and even aging itself. Adiponectin is a hormone that is only secreted by adipose tissue, fat tissue, and supports weight management in the brain. Similar to leptin, though adiponectin helps insulin sensitivity and inhibits inflammation, and it's often reduced in metabolic syndrome. We can measure these adipokines and verify progress. This can be done while also measuring other metabolic and cardiovascular disease risk markers. So I think it's important to start looking at leptin, adiponectin, and it'll give us a sense of what is out of balance, what do we need to do, where are you in this game, in this whole range of metabolic syndrome and inflammation, and by measuring these markers, it'll give us a sense of how well are we doing, how are we changing things. Obviously we want to decrease the weight, but we also want to make sure that we're dealing with the inflammation and these other things that are going inside the body, because that is really important. So how effective is our diet, lifestyle, nutrition, herbal, and pharmaceutical treatments? Let's be proactive and preventive in our monitoring. This is a company that I'm becoming familiar with. They do a screening. I guess it's more than a screening. It's a really complete set of testing that gives us really good information about all these things that we talked about. So how's your heart doing? This can be a good sign if we're getting close to having a heart attack. So it's a good screening to see about the inflammation in your heart. Inflammation in your vasculature, atherosclerosis, all really important things like, we talked about the CRP, homocysteine, B12, folic acid, these inflammatory mediators. And part of the way that it does this is by looking at genes as well and your individual genetic polymorphism. Looking at problems with cholesterol, a detailed look at cholesterol and triglycerides. And then all these things that we talked about, vitamin D, calcium, magnesium, leptin, adiponectin, ferritin, a sign of inflammation, and iron metabolism, cortisol, testosterone, blood sugars, thyroid, even uric acid. So we're going to be seeing more and more test panels that will be doing things like this. And this company realizes, and a lot of these companies do, a lot of these tests can be really, really expensive, but they know how valuable it is and how important it is to monitor it. And so they actually work with insurance companies to make it affordable so that insurance companies cover it and so that your out-of-pocket expenses are minimal. And they work well with practitioners to find ways to make it affordable for patients who do not have insurance. But I've been looking for a test like this, and knowing that I'm talking about this, I've been trying to find the perfect test, and this is up there. So I'm still looking, as well as something called Nutrigenomics. I'm still debating how valuable Nutrigenomics is. Before we get to that, just a couple quick things. You've probably, if you watched Dr. Oz, you've probably heard about raspberry ketones and what else? Raspberry ketones and help me out, African mango and green coffee beans and all these things, right? So if you look at the science behind them, and there's some really good science, look at how they work. Increasing adiponectin, which is what we want to do, regulate glucose metabolism, increase fatty acid catabolism, breaking down fatty acids, decreasing liver and organ fat, improve obesity, help with fatty liver, increase helping deal with stress and the breakdown of fat. African mango, same things. Suppress appetite, helps with hunger, increase metabolic rate, slow body fat production, slows conversion of complex carbohydrates into sugars, downregulates adipogenic transcription factors and leptin. So all these things that we talk about. So there are natural treatments that work this way. And I'm going to be spending some time next week. I think we're having a lecture here with a panel discussion. I can't remember whether it's Tuesday. And then we're having another group discussion on Tuesday and Thursday. I have two lectures. I can't remember which one is which. But if you're interested in one of the lectures is going to be on Dr. Oz's specials. And so we'll go into more talking about this. One last testing that I want to introduce is called Nutrigenomics. The field of nutrigenomics focuses specifically on the mechanisms by which nutrients and dietary bioactive molecules affect gene expression. So how does nutrition affect whether genes get expressed? That's what we're talking about with epigenetics. Have you heard of epigenetics? So in the whole nature versus nurture debate, we've always been taught, well, there's been a debate. What's more important, the environment that we live in or our genes? Well, I think that the environment wins because we've now discovered that genes, when we did the Human Genome Project, we thought we'd get the answers to everything, how the genes work. And what we found out is there's so many genes that can't be accounted for. We don't know what they do. And that's because they get either turned on or turned off based on our environment so that we can adapt to our environment. And whether these, where do I want to go with that? What we eat, what we're exposed to is so critical for whether these genes get turned on and get turned off. And what we found is with epigenetics is that these genes get just like genes get passed on, based on what we're exposed to in our environment, we'll turn on and turn off the gene, but that will get passed down over generations. So the potato famine in Ireland affected the great-grandchildren of the people who went through that and how their genes get expressed. And there's a lot of that has to do with methylation, but there's this different process of turning on and turning off genes so that we can adapt, and so that what we're exposed to in utero will prepare the baby that comes out for that world that he or she's joining, so that you can adapt. So pretty amazing stuff. And that field, this field is exploding, and that really lays the foundation for how and why it's important to look at what we eat and to pay attention to our environment and to do all the things that we talk about in Nature Cure. Just as far as with this is one company that I'm looking at to possibly work with to do Nutrigenomics. I don't know how necessary it is. I'm still trying to explore. There's a lot of controversy as to whether what you get out of the testing is valuable. I'm still looking into it. I think there could definitely be some benefit to it, and some of that is already in that, like other tests that I showed you. But by doing like the organic acid testing, we get a lot of those answers because we're seeing how your body's functioning based on the nutrition. But my jury, or I haven't decided yet exactly about Nutrigenomics, but I want you to know that it's out there, and you'll be seeing more and more of that, I think. So I appreciate your patience. I know I covered a lot of topics. Thank you for listening to my story. And if there are any other questions, I can address that. And then if you have a few personal questions, I'll be to the side here and can help you with that. But don't forget, if you're interested in hearing more, I like to do talks every month or so. And so sign up. You can get more info about my talks. If you can go online on pilgrimswellnessclinic.com to get more information about me and to hear past lectures. Thank you for coming, and I'll stay around for a few questions.